Welcome everyone to the Week 6 presentation for ME 105 Medical Terminology. Diving right in, we are focusing on the circulatory system this week, which happens to be Chapter 7 in your textbook. So the circulatory system, let's just go over a few general basics. So the heart receives blood from the veins and pumps blood into arteries. The blood vessels are what actually transport the blood throughout the body. Arteries transport blood away from the heart, generally speaking. The capillaries, this is where the actual exchange of nutrients and waste between the blood and the cells take place. These are very minute blood vessels between the atrial and the venous systems. Getting to our venous system, the veins return blood to the heart. The blood, that's the transportation medium, so it brings oxygen and nutrients to the cells and carries waste away. The area where our heart is located is found between the lungs, and it's known as the mediastinum. Looking more specifically at our heart, here we can see the flow of blood through the heart and some just general reminders. The pericardium, that's the double-walled membranous sac around the heart. There are 3 layers to the wall of the heart: the epicardium, the myocardium, and the endocardium. We have 4 chambers to our heart. The atria are our 2 upper chambers, and our ventricles are our 2 lower chambers. Several valves to be aware of: the tricuspid, the mitral, also known as the bicuspid, pulmonary semilunar, and the aortic semilunar. And we have coronary arteries. It's important to remember our heart is a muscle, so it has to have a blood supply of its own. That is via our coronary arteries that supply blood directly to the heart itself. On the slide here, you can see the flow of blood through the heart. We go from our vena cava to our right atrium, to our right ventricle, to our pulmonary artery, out to our lungs where we pick up oxygen, back into the heart at the left atrium, down to the left ventricle, and that left ventricle pumps blood out to the aorta and the rest of the body. There are actually considering 2 types of circulation. So the 2 types of circulation are the systemic circulation and the pulmonary circulation. The systemic circulation is the flow of blood to all parts of the body except for the lungs. Everywhere else, just not the lungs. So blood leaves the left ventricle and goes through the aorta to all the arteries in the body. The veins in our systemic circulation carry deoxygenated blood back to the right atrium of the heart. Our pulmonary circulation is a little bit different. It's the flow of blood only between the heart and the lungs. That's it. Heart and lungs, that's it. The pulmonary arteries are the only arteries in the body that carry deoxygenated blood, and they go out of the right ventricle to the lungs where it gets oxygenated, and then the blood returns to the heart through the pulmonary veins. Those are the only veins in the body that carry oxygenated blood, and it's between the lungs and the left atrium. Next, let's talk about blood pressure. So, blood pressure is the measurement of the amount of systolic and diastolic pressure exerted against the walls of the arteries. Systolic, this occurs when the ventricles contract. The highest pressure, this is the highest pressure against the walls of an artery. Diastolic occurs when the ventricles relax. This is the lowest pressure against the walls of an artery. Our reading is always systolic over diastolic. A blood pressure of 140/90 is considered hypertension, which is high blood pressure. Our normal reading is on the slide here, 120/80. There are 9 atrial pulse points in the body, and you can see those on the slide here as well. Lymphatic circulation, let's talk about that next. So our circulatory system, we have our cardiovascular circulation, and then we have our lymphatic circulation. They do kind of go hand in hand. They do tend to run parallel to one another at times. Lymph is what is transported by the lymphatic vessels or this lymphatic circulation. And lymph is a fluid. Next, we are going to focus on a number of pathologies that are going to be important to you. So let's work through these. Angioma. If we break that word apart, OMA refers to a tumor or a mass of some kind. Angio is going to refer to vessels or vasculature. So angioma is a tumor consisting principally of blood vessels or lymphatic vessels. Hemorrhagic stroke. If we think of hemorrhage as a bleeding, this is a stroke in a blood vessel where it burst and a large amount of blood seeped into the brain tissue. Murmur, that's just a term you have to remember. It's a soft, blowing, or rasping heart sound. Angina pectoris. Angina is going to be pain of some kind. Pectoris, if we can remember our muscular system, is going to be in the chest. This is severe pain and constriction around the heart caused by insufficient blood supply. Congestive heart failure. This is a condition characterized by weakness, shortness of breath, and edema in the lower portions of the body. Those are some signs and symptoms. Myocardial infarction. The myocardium refers to the actual muscular part of the wall of the heart. Infarction is going to incur some sort of death. So it is a death of part of the heart muscle. Pericarditis. The pericardium surrounds our heart. It's the sac. Itis always indicates inflammation. So pericarditis is inflammation of the membrane surrounding the heart. There's a medication I want you to be familiar with. Antihypertensive. This is a class of medications. It's a term for a drug that's used to treat high blood pressure. Antihypertensive. Anti is going to mean that we're going against something. Hyper is always going to mean elevated or high. Treatments. Looks like we have 5 treatments to focus on. Actually, one's a diagnostic procedure, so I take that back. 4 treatments in a diagnostic procedure. The first one is coronary artery bypass graft. This is an operation when a blockage of a coronary artery, again, the coronary arteries go directly to the heart, is too severe for a percutaneous or through the skin procedure to be effective. So they actually have to replace that vessel by taking it from somewhere else. ICD is implanted cardioverter defibrillator. This is an internal device, so it is implanted into the body to deliver a low energy shock to reestablish normal rhythm when sustained tachycardia or fibrillation is detected. Balloon angioplasty. It's a procedure where a balloon catheter is inflated inside a vessel to flatten plaque against an arterial wall. Phlebectomy. This is an excision. That omi is going to mean that ectomy, that excision, and phleb is going to indicate vein. So this is an excision of a vein or just a segment of it even. The diagnostic procedure I want you to know is echocardiography. This is the use of ultrasound for the heart. So any kind of echocardiogram, echocardio, anything with that prefix is going to mean ultrasound of the heart. So it is used to help diagnose a heart disease. Next, it's your turn. So at this point, that hits the high points of Chapter 6. Please do remember to read that whole entire chapter on the circulatory system. As always, if you have questions, I'm always here to help you. You're never in this journey alone, so definitely reach out when need be. The information from today's presentation did come from your textbook. Thank you so much for your time. Have a great week.